All right, I would first obtain the doctor's orders. I would make sure that the indwelling catheter is what was ordered. I would look over any medical issues that would prohibit me from inserting a catheter, also any allergies, and if there was any abnormalities there, then I wouldn't insert the catheter. So I would walk in, provide for privacy, doors closed. I would perform hand hygiene and then introduce myself to the patient. Hi, my name is Kylie. I'm a nursing student and your provider has ordered a urinary catheter for you today. So that is a tube that is inserted into the bladder through the urethra and it's just used to drain urine. So I'm here to do that for you. Is that all right? Okay. I'm going to go ahead and have you verify your first and last name. Awesome. And your birthday. Okay. And do you have any allergies? Okay, so the patient has verified they don't have any allergies to anything that I'm using. So I'm good to go ahead and continue with the procedure. So I'm going to go ahead and gather my supplies. I have my Foley kit here and my stat lock. I'm going to set out a clean pair of gloves for after the catheter is put in. And then I would clean this table, and this is the table that I'm going to be using to set up my sterile field. So this has been cleaned, and then I'm just going to go ahead and pull up your sheet, okay? We're going to keep this on your abdomen, and I'm going to provide period care first. Okay, so we're going to roll this up and keep it right here. And then I'm going to raise the bed to my height, all right? Okay. And I'm just going to lift your gown and we're going to keep it right here on your abdomen as well. So I would provide pericare, so I've already done that. It's dried well. And now I'm going to go ahead and wash my hands and then we'll get started, okay? So now I go, wash my hands, come back, and then I'm going to lower the side rail. Maybe. Okay, well, we're going to pretend that that's okay, and I'm going to have you get into what we call the dorsal recumbent position. So you're already laying back, so that's perfect. We're going to have your knees be flexed and your feet apart. So we're going to be just like this, okay? Okay, and I'm going to keep you in this position, and then I'm going to get everything set up. This is a sterile procedure, so I'm going to have all my stuff down here. So I just ask that you don't reach down and touch any of it, or we'll have to start over, okay? So I'm going to obtain my Foley kit. I'm going to take this out of the wrapper, and I'm going to use the wrapper as a trash bag at the end of the bed. Okay. And then I'm going to set up my sterile field. Okay, and then I'm going to take this drape and I'm going to lay this drape right here in between your legs, shiny side down, okay? And then I'm going to put on my sterile gloves. And now I am going to move my sterile field, fix the drape, and I'm going to move my supplies over here. And then I'm going to get everything set up. Get these loose, make sure they're easy to get out. And I would open my lubricant. Actually gonna turn this way. Open my lubricant and I'm going to look at my catheter. I'm using the smallest size possible. This is a 12 French catheter. And I'm going to go ahead and lubricate. And then try to loosen that so it's easy to get out. Okay. And then I'm going to go ahead and attach my syringe to my catheter. So that it's ready to go. All right, so now I'm going to go ahead and clean the area. So I'm going to be taking my hand and I'm going to use it to spread your labia, and I'm going to be cleaning with swabs, all right? And my hand will stay there throughout the procedure. So I'm going to start farthest away from me. One wipe down. I'm going around the sterile field. Drop it in. And last one, I'm focusing on cleaning the urinary meatus. Okay. Then I'm going to get my catheter. And insert. Just breathe normally for me, okay? I'm just inserting until I get urinary feedback. So I've got urinary feedback and I'm going to insert 2 more inches. Okay, and once I've inserted 2 more inches, I'm going to let go with my non-dominant hand. I'm going to grab the catheter and inflate the balloon with the 10 milliliters of normal saline. Okay. Then I want to check, make sure there's resistance, and there is, so that means the catheter is in place. Any pain or discomfort? Perfect. So now I will go ahead and remove my gloves and put on a clean pair of gloves. We're almost done. Oh, there's a new one. Okay, so then I want to place the stat lock on. There we go. And for this, I would have the patient completely extend their leg. And then I'm going to go back about 3 more inches, place it right about here, just to give them slack, because if there's no slack when they move, it's going to tug on that catheter. Place it right here on the thigh. So then I can go ahead and discard of this. I could use the drape to clean my patient if they had any lubricant on them. And then I can go ahead, and since that's secured, we can go ahead and lay your legs back down and you can relax. Pull that gown down. And blanket, and then I would attach the bag to a non-movable side of the bed, lower than the bladder, so that the urine can flow into the bag. And then we could also clamp this to the sheet if we wanted to prevent from moving. Right, and then I will lower the bed back down. And then I would make the patient comfortable. If they wanted to keep laying down, they could keep laying down, or they could sit back up. Are you okay to stay laying down, or do you want to sit back up? Okay, we'll leave you laying down and you can get some rest. If you have any pain, just let me know. And I'll be back in to check that urinary output a little bit. Then I would clean my supplies. I'm gonna keep a syringe. And I would perform hand hygiene, and then I would make sure side rails are up, beds lowered, call light is in their hand, we're going to say. And then now we are going to stimulate, continuing the IV. So same procedure as before. I would obtain the doctor's orders, verify that discontinuing the IV is what the doctor has ordered. It is, looking over any allergies once more, and then, yeah, walking into the room, provided for privacy, performing hand hygiene. Reintroduce myself. Hi, my name is Kylie. I'm a nursing student. Your provider has ordered to discontinue your urinary catheter, so I'm here to remove that for you today. So now that I have explained what I'm doing, I'm going to check the bag. I'm going to measure the output if necessary, empty the bag, note any characteristics that I would need to chart about the urine, and then I'm going to clamp the tubing. And then once that is clamped, you can go ahead and get ready. So we're going to roll this blanket back up again, just kind of like it was. I'm going to put on gloves. Okay, so then once again, I would perform any peri-care while the catheter was in, and then I've performed hand hygiene, put on gloves, emptied the bag, and I'm going to have you get into the same position that we got in when we inserted the catheter. So we're going to raise your legs. Perfect, and I'm just going to put a disposable pad underneath you. This is just in case it were to get a little messy. We don't want to get the sheet stained, okay? Right, and once that's done, I would want to remove the stat lock first, and while I'm doing that, I want to stabilize the catheter and make sure that when I'm removing this, it's not tugging on the catheter. So I would stabilize that, use alcohol to remove this. Then I just remove the stat lock, would throw that away. And now I'm going to remove the catheter. So once again, I'm going to place my hand on your labias, okay? We're going to take out that catheter. Oh, I need to deflate. I would use my syringe to deflate the balloon before taking it out, so I felt that resistance first. And I'm taking out 10 milliliters, the same amount that I inserted into the balloon when I first put in the catheter. Okay. So took out the 10 milliliters and now it's ready to be removed. Okay, and I'm checking the catheter, making sure that it's still intact. It is, the integrity still looks good. And then I'm also looking at the urinary meatus, making sure that it all is still intact. It looks good, no abnormalities there. I will just wrap this up in my glove. And throw this all away. And then I would put on gloves again. Wipe the area. If the patient wanted any peri-care after removal, provide peri-care. I'm just going to help you get back into a comfortable position. Okay, do you want to keep laying down? Perfect, okay. So the bed is lowered, the 2 of the 4 side rails are up, call lights in hand. Since that urinary catheter is out now, just let me know when you first use the restroom, and I'm gonna come measure that, okay? All right, and then clean up all my supplies, perform hand hygiene, and document the urinary output when they first void. All right. I think that's it.
Okay, I'll be right in.
Okay.